So welcome everybody. This is a session 8 of the O'Neill Colloquium on National and Global Health Law. And our session today is Undermining Science and Public Health Agencies, How to Give Public Health a Fighting Chance Against Economic Forces, Politics, and a Growing Rejection of Science. The COVID pandemic has brought to a head more vividly than any of us could have imagined the role of science in public health and policy responses to an epidemic outbreak, and in this case, a pandemic. We've really seen kind of the best and the worst of the world. We've seen the best in the sense that there's never been, in my experience, as rapid progress and scientifically, both in terms of epidemiological understanding of how SARS-CoV-2 is spread, as well as sequencing the genome, and then rapid research on therapeutics and on vaccines, with currently 9 vaccines in phase 3 clinical trials in lightning speed. But at the same time, we've also seen public distrust in science, politicization of science, and particularly our prized scientific agencies internationally, the World Health Organization, and in our own country, the FDA and the US CDC, have all been struggling with how to make science come first in the response. And along the way, we've got vaccine hesitancy, we've got worries about going too fast with vaccine approval, and a whole range of things. For me, this actually feels like a reunion, because our panelists, they're all actually among my oldest friends. We go back so many years in so many different ways, and we've been through so many epidemics and outbreaks together, and friendships and things. So it's really been, quite remarkable for me, and it's just really humbling to see this group. I've said this before, students, but I say it really doubly now. It's really incredibly fortunate of you to have a world-class group like this, probably among the 4 best scientists the United States has on offer. I won't have the pleasure and privilege of introducing everybody, but I will introduce Jesse Goodman, who's our moderator. Jesse directs Georgetown's Compass. It's a center which focuses on informing science-based policy to address public health needs in product development. Until February 2014, he had long and very distinguished career at the US FDA, most recently the chief scientist of the FDA. And he's also worked closely with our public health agencies, CDC, NIH, WHO, a member of the National Academy of Medicine, and so much more. As Jesse and I were saying before we got on this call, I've gotten to know Jesse awfully well, because he chairs the Georgetown Public Health Advisory Group that's advising President DeGioia about reopening and various pilots that the university's going through. And I just have to say, I've just been in awe of him, at his command of the science, his judgment, his leadership of this group and the university. So we have, as a university, as a nation, as a world, we have a lot to thank Jesse for. So over to you, Jesse, to introduce our terrific panel, and then I'll stay in the background as Professor Crowley will, and we'll come back in an hour and start the second half of the class. So thanks again, and over to you, Jesse.
Thanks, Larry. And thanks for your kind comments, which I totally agree with about our three panelists, but you're definitely overinflating, particularly on any ability I might have to make a pie out of the chaos. But anyhow, I'll just, I think for the students and folks, Neil, just to say it is incredible that to have, Mike or Jim or Howard, to have one of them is a great thing. So to have all three of them and these bring very different perspectives, but are all stars, is really great. And I'll just sort of briefly introduce them. You can read their more about their biographies, but I'll sort of give you more of my quick perception. And, Dr. Curran is a real godlike figure in the whole HIV response. And, I was an infectious disease fellow at UCLA when we first had those patients. So it was seeing his MMWRs and all his work responding to the HIV epidemic. And he's well recognized as having been a global leader in HIV and still is co-chairing the Emory Center and is dean of the School of Public Health and a professor at Emory. So, you couldn't have somebody with greater experience responding to an outbreak in the midst of all kinds of politics. So I'll look forward to his perception. And it's good to remember that, some of these tensions have always been there. We are in extraordinary times, but we can learn from that. Then, Howard Bauchner, is just a fabulous physician, professor, and I have to look at my notes when you became editor of JAMA, 2011. And I think Howard has really been a leader in communicating science and medicine, both to the healthcare profession in a way that hasn't been done as well before and publicly. And their response to the pandemic and the information they put out on quick turnaround is just been incredible. And, it's been a pleasure to work together with him on a couple of the issues, and particularly on the issue that's dear to me here, which is, protecting and preserving the integrity of our scientific and regulatory agencies. So I really will look forward to his perceptions. And then, Mike Osterholm, I think the real thing to say is Mike has been an incredible, tireless, advocate for the importance of emerging infectious diseases and why we need to be better prepared, how we need to be better prepared. He's a distinguished scientist and epidemiologist, but he's also played an incredible role, I think, as a advocate, as keeping people's eye on the ball and keeping people honest. And I really appreciate that. And we had the pleasure of, when I was at the University of Minnesota, to work together on a couple of issues, and it was really a privilege. So this is a team of stars. They're great. And on the science issue, I don't think we have ever seen anything like this. I look at my experience in almost 20 years in government. People used to come up to me and say, how could you work under this administration or that administration? And I never had a lot of trouble answering that. I always said, well, I treat people with respect. I tell them the truth. And at the end of the day, that becomes valued. And that was my experience serving FDA commissioners, 5 different ones, Republican and Democratic. So we are seeing something really different here, an attack on their integrity directly, not just an effort to influence their decisions, but attacks on their integrity and on how the public views them. So this is an incredibly important decision and discussion. For example, on vaccines, we're at a point where majority of people in this country believe that a vaccine approval or authorization decision would be politically driven. That's a terrible place to be. It's not a hopeless situation, but it's one we really need to fix. So what I'd like to do is just, our format was to give each person a chance to make a few comments, share their perspectives on this issue, and then we'll open it up for discussion. So we're going to start with Dr. Curran.
Well, thanks, Jesse. I want to just say a couple things. One is that I've really greatly admired all of you guys. And since I've known some of you since you were young and I was just early middle age. So we do go back a long, long ways.
You do.
And And Larry has done an enormous job in putting public health law on the map as something that has helped the whole world. So thanks, Larry. This is the public health crisis of the century. So nothing has happened like this in any of our lifetime. We may have feared it before, but now it's here. It's a respiratory virus that's very serious, that's new. It's helpful to remember it's only 11 months old. A lot of times we think it's been here forever, but it's 11 months old, and our knowledge of it is 11 months old. Our knowledge of the natural history is 11 months old. The science has been really fast in terms of basic science in the viral genome getting sequenced very quickly, new therapies and vaccines being developed, hopefully quickly, and that's been really good. And public health is always political. You're always involving different groups of people and trying to convince different groups of people. But in a pandemic, it really should not be partisan. Now, public health has always been a little partisan, but I think this is about the worst that I've seen in my lifetime. I've had experience with the swine flu epidemic, which was controversial, but developed a national consensus before it started. The AIDS epidemic was largely a federal problem, only of neglect rather than interference. We were all broke when Reagan became president. He didn't say the word AIDS till 1987 in public. Congress put some money in eventually, but this was neglect rather than interference. Never during the time that I was at CDC was I prevented from talking to the press about an MMWR, or sometimes bawled out for seeming to exaggerate the problem. But the CDC scientists were always available to the press when things were published. CDC's been putting out 3 or 4 MMWR articles a week with eventually nobody commenting on them. The Ebola epidemic was different, of course, but it didn't really catch America's attention until we had some cases here at Emory Hospital and other places when people started to realize that it had some global implications. But nothing like coronavirus has happened before. CDC has been demonized the most. They made some mistakes, particularly in the area of testing in the beginning, but they've been demonized for things which are not mistakes. One of their scientists, Nancy Messonnier, one of the world experts in respiratory epidemics, was essentially shut out because she warned the government and everyone else in February that this was going to be a big problem. She sounds like Mike Osterholm, but she was in government, and she turned out to be right. So where are the people coming back and saying, we're sorry, Nancy, you were actually right about how bad this is going to be. Maybe you underestimated it. I got away with that with AIDS because I was constantly telling people there were problems, and I would always say I'm probably underestimating it, and I actually was. CDC is still the world's best public health implementation agency. We've seen some problems with CDC during this time period and some need for reformation and some need for figuring out how they work within the federal government. But other countries emulate CDC and want to be as good as CDC. And we need a very, very strong CDC without strong interference. The last thing I guess I would say is that we have to have consistent communication, and we have to have policies that aren't based on scarcity. We've had several examples of that, as well as prognostication based on wishful thinking. So we didn't have enough masks, so we told people they didn't need to wear masks. We didn't have enough tests, so we said, well, you don't really need to go to the doctor to get tested unless you're really seriously ill. What we really meant was we don't have enough tests, so we're going to save them for people in the hospital. Of course you need to get tested if you're a contact or you're asymptomatic. And then we said, well, there probably isn't much asymptomatic transmission, unlike most other respiratory viral infections, when in fact, the prudent thing would be to say there's probably a lot of asymptomatic transmission. And to this day, we grossly underestimate asymptomatic transmission. It's amazing how we think we can have 30 or 40 million people infected in the country and only 8 million diagnosed. I mean, a lot of those people must be asymptomatic or mildly symptomatic, but we didn't want that to be. And then we didn't want the children to get it. We didn't want children in schools to get it. We didn't want children to be capable of transmitting to adults. So we searched for crappy data, which would say that maybe they don't get it. And we said, oh, don't worry about it. They won't get it. But we didn't have enough tests for them anyway. So what I worry about now is the wishful thinking about a vaccine. We don't know about how effective the human immune response is in the short term in preventing transmission and in the long term. This is very unlikely to be like measles. We'd like it to be like measles. We'd like people who get infected to be immune forever, but we don't know that. As a matter of fact, there's some evidence they aren't. They seem to lose antibody. So a vaccine, which initially is like the human immune response, may be inadequate because the disease is only 11 months old. Now, that isn't to say we shouldn't be hopeful. I'm hopeful for two reasons. One is the science has been amazing and quick. There'll be first, second, third, and fourth generation vaccines. And the main reason I'm hopeful is the damn virus only lasts 3 weeks. I've spent my career with virus that lasts forever, with 40 million people still infected with HIV. And if we could stop coronavirus in its tracks today, a month from now, there wouldn't be any coronavirus. Now, I know that that's not possible, but we should be having strategies that try to make it possible and take examples of places where it's actually been done. So there's a good future for us, except we need stronger leadership and consensus building. With AIDS, we had things like the Ryan White Care Act, co-sponsored by Orrin Hatch and Kennedy. Why can't we do that now? Why do we have to have this terrible partisan political divisiveness, which leads to mixed messages and an inconsistent public response? Sorry if I got too excited about it.
No, thank you, Jim, very much. And you made me want to ask you a whole bunch of questions, but we'll stick to our plan. And I guess I was going to go to Howard next.
Thanks, Jesse. When we get to Q&A, I'm happy to take questions on any issues that I either talk about or don't mention that people are interested in. So why don't I start with what our database is at JAMA. So we've had 11,000 submissions related to COVID-19 since February 1st. JAMA's published about 250 papers, opinion pieces, research letters, research reports, clinical reviews. I've read of the 10,000, probably about 7,000. And some are really quite provocative. Some obviously really question science. So then what becomes the role of a journal? And I think the most important element that pertains to this discussion is that modern journals that are well-resourced and high quality have become communication centers. We do print JAMA. We have about 1.5 million followers in social media. We can produce podcasts and videos. And so I think the fundamental change over the last decade is the way in which publications from JAMA can reach both the medical community as well as the public. And so we decided early on that we needed to harness that network to try to bring current evidence-based recommendations, either in the form of research reports or in interviews. So I've interviewed Michael twice. I've been fortunate to interview Dr. Fauci 8 or 9 times. And so I think one of the things is to leverage the brand that is JAMA to try to make sure people understand what the data are. And I'll give you an example. A week ago Monday, we published 3 viewpoints, 2 research letters, and 2 editorials. One of the viewpoints was entitled "The COVID-19 Pandemic and the $16 Trillion Virus." And it was written by David Cutler and Larry Summers. That's been picked up by 66 news outlets, and 3,530 people have retweeted it to 23 million individuals. We published a research letter by Steve Wolf 161 news outlets, 32,000 tweets, 13 million people have seen the content of that research letter, which estimated that excess COVID-19 deaths by January 1 will be close to 400,000 people. And, Jesse's published a piece in JAMA about questions that the public are going to commonly ask about vaccines. And so our goal over the last 6 or 7 or 8 months is to use our different channels and the brand that JAMA stands for to try to educate both the clinical community as well as the public. On occasion, we've gone outside the norm. So apparently President Trump does not like 60 Minutes. But this was not the first time he attacked Dr. Fauci. He attacked Dr. Fauci in April. And on Monday of following the weekend in which he had initiated yet his first verbal attack on Tony's credibility and scientific know-how, I wrote an open letter that went out on our social media channels. I've never done that before. And, I indicated it just needed to stop. The personal attacks of people I abhor, and certainly for someone of Tony's stature, was unconscionable. And I was pleased that week many other professional societies rallied around trying to damper the criticism. Obviously, it resurfaced over the weekend. And just two other final comments. When I interviewed Mike the first time, Mike said, "Could you have me back in 2 weeks?" And I said, why don't I have to have you back in 2 weeks? And he said, "Because I have to be careful, because probably half the things I'm saying today may not be right. And I'd like to come back in 2 weeks so I can correct them." That scientists need to remain humble. What do we know and what don't we know? In some regards, Jim emphasized that. So my great disappointment was that there was a letter in New England Journal in late January about asymptomatic spread. And within a few days, it had been criticized for being potentially untrue. JAMA 2 weeks later had another letter from a different group talking about asymptomatic spread. And yet we weren't honest enough with the American public to say, we think there could be asymptomatic spread. There's not enough masks. So we're not quite sure what we should do now, rather than people coming out and saying, don't mask, because that just gave the wrong message. And then when we tried to change it to masking, we really ran into problems. So I think honesty and being humble just is critically important. But medicine owns some of this. And I always try to reflect on what we could do better. So I think many of you are probably aware of the Great Barrington Declaration that was released about 10 days ago. And there's been kind of a John Snowden response. It's gotten nasty. These are between scientists, and it's gotten nasty. And I worry that when the dialogue becomes nasty, are we just duplicating what we see from the executive branch? And I think that's a struggle. I'm not sure the best way forward, because there's very strong feelings about herd immunity and the Great Barrington Declaration. But if we can't discuss it in a civil way, are we any different than what's happened emanating from the executive branch over the last 6 or 7 months?
Thanks, Howard. Great points, and look forward to discussing them. Mike? Mike, you're muted.
So thank you very much. It's a great honor to be here with this group. Jim and Howard and I go back a long ways. Jim and I almost worked for Jim back in 1978, and Howard and I both shared the same mentor, Jerry Klein, a wonderful pediatrician. And it's good to see Tim Westmoreland, who I have always believed was the greatest champion of childhood immunizations I probably ever met, and did more to make that happen. Larry, of course, is a legend unto his own. And then Jesse, it's great to see you again. So you guys as a class, please understand the people you've got here. There actually are some pretty special people. Let me just take a step back and say I've been in this business for 45 years. I've been at the University of Minnesota the entire time. And I also served at the Minnesota Department of Health for 25 of those years as state epidemiologist, doing a dual role. I also have had roles in the last 5 presidential administrations. The most recent one is served 14 months as a science envoy for the State Department in this administration. I served 2 Republican governors, 2 Democratic governors, 1 independent governor, or as we like to affectionately say, 1 independent wrestler, Jesse Ventura, when he was governor in Minnesota. And, you know, no one could tell you publicly my partisan politics. I consider myself a private in the public health army. That's my job, to do it, call balls and strikes, and leave it as such. So my comments we made as such today, very much building on what Jim and Howard just said. First of all, let me just share with you that we all, I think, have to take a step back and acknowledge that there was a lack of creative imagination about this particular pandemic. Our group began following it very carefully at CIDRAP in late January or in late December. We saw what was going on in social media, and we have a news team that covers things across the world. We actually had people on the ground in Wuhan that we knew that we were talking to the first week of January. And I'd spent a lot of time working on MERS and SARS. I was actually right after 9/11, split my time as a special advisor to then Secretary of Health and Human Services, Tommy Thompson, and worked on SARS as part of the federal response in 2003. And in 2012, after MERS emerged on the Arabian Peninsula, I served as a special advisor to the royal family of the UAE and worked a lot on MERS on the Arabian Peninsula, and recognized that, in fact, this was a disease where transmission as a coronavirus would be likely well after 6 or 7 days of symptoms before one became infectious. And that's how we so easily have contained human transmission. Once we understood that, is we would identify cases early, isolate them, and literally brought SARS to an end when we could also eliminate the animal reservoir out of the markets of the Guangdong province. Not so successful with MERS, in that it's 1.7 million camels in the Arabian Peninsula are our animal of choice, and we weren't going to put them all down. So we continue to deal with that. But so when we saw what was happening in Wuhan, our first reaction is we hope it's not flu. If it's flu, this is not good. And when we recognized within the first days that it was not a flu virus, that in fact coronaviruses were being isolated by January 10th, actually had the sequence, I went from being quite optimistic and positive to saying, oh my God, look what's happening. We had evidence by that time that there was substantial asymptomatic transmission. We had many patients who in of themselves had no contact with someone who had clinical illness. And so that was very different than MERS and SARS. And as such, as we continued collecting information like that. And so when people talk about, the Chinese suppressed information, I think that the local Chinese health officials did, not the federal government. But there was more than inadequate information to understand what was going on. And on January 20th, I put out a statement from our center saying that this was going to be the world's next pandemic. This was why I laid out the issues as I just have shared with you. And I have to tell you, between then and March, including a February 20th op-ed piece in the New York Times saying, let's get on with this. This is a pandemic. We need to respond accordingly. We're not going to contain this issue. The number of very negative emails I got from public health people were remarkable, for saying, why in the hell are you scaring everybody again? This is just scaring people. The flu is much worse, including, and some of them came from people today who are some of the most prominent spokespeople around the coronavirus pandemic. And I'm not here to say, oh, I was so right, but it's one of the challenges we've had is people in our business often don't think with enough creative imagination to imagine what can happen or why it might happen or where the data will lead us. I came into this assuming this was going to be another coronavirus situation we would put down quickly. I had to completely rethink my point. So when Howard mentioned about, let me come correct the information, I've been in that mode from the very beginning here. What do we learn something? What new do we learn that then makes us go back and revisit this point? So I think one of the messages I'd have for you is keep your eyes wide open. If you have an expert in front of you, listen carefully, but be skeptical, okay? Because in the end, we don't know for certain, what we have. Let the data speak for itself. And I think that that's been a challenge with this particular pandemic. Let me just make a couple of comments about the issue of what it's like to be in this business. In the 45 years I've been in this business, I've never experienced anything like this myself in the past, 9 months. I've watched the partisanship really, as Jim and Howard both have indicated, really have a major impact on what public health did or didn't do. CDC has been the crown jewel of public health activities around the world. It has been, in essence, basically neutralized as a credible voice. You don't know what to believe and not believe. Similar situations have occurred with FDA. Jesse can surely speak to some of that, some of the challenges there. And I think what is probably more troubling is what's happened at the state and local level. 40 of my colleagues, I was a state epidemiologist, as I said, for 20 some years, have resigned or been fired over the course of this pandemic, 40. And in large part, it was they were resigned because of the fact of the threats to their life. I have an open file right now at the University of Minnesota Police Department with repeated death threats. I've never had that happen before in my career. And this has taken on a whole new element of what public health is all about and what it means to stand up and speak out about public health and what we need to do. And so I have to say that again, calling balls and strikes in a nonpartisan way, surely this administration has furthered that whole issue and has empowered it in a way that I would never have believed. As I mentioned, I worked for those governors in Minnesota. Not once in my career was I ever asked to change a public health recommendation or to do anything other than what I thought was my job by any of those governors. Didn't matter what their party was. Public health basically was about doing the right thing for the most number of people at the time. And I worry that what has happened is we've crossed over to a land that we may never get back from. And I hope that's not the case. I hope that we can restore the credibility and we can restore the science-based approach of public health. But I worry about that. Maybe we've gone too far. Maybe we live in a new world order and I'm just an old man that should retire and just acknowledge that this is a new world and I probably don't fit into it very well anymore. But at the same time, I think that's what you as students have to demand. You need to demand to have science-based, strong public health agencies because it is about the health of all of us. And you can't barter or bargain on that. And I understand it. And as Jim said, surely I saw political issues going on with public health, but I never saw anyone once try to tell us what to do and how to do it relative to public health practice. So I would just leave you with the fact that this is a really critical time. One, are we going to learn from our mistakes? Are we going to be, again, vulnerable to another next pandemic? And don't forget, right now as I speak, there are 23 billion chickens on the face of the earth. Half of all the weight of birds in the world is a chicken. That's to feed the 8 billion people who need that protein. There are 390 million pigs on the face of the earth right now, just so that they can feed, again, that 8 billion people. And unfortunately, many of them live real close to each other, and they are the ideal mixing vessel for the next influenza pandemic. If you think this one is it, this is it, this isn't the big one. I fear desperately that the big one's yet to come. And so from your educational standpoint, I hope you realize that it is important we get this right, not just to finish this one up and to try to bring it to hopefully some moderately successful conclusion, but it's also about what's coming down the pike. And so we've got to fix public health. We've got to be creative. We got to imagine the future, and we got to think about what is it going to mean for your world. So with that, I'll end and hand it back to Jesse. Thank you.
Thank you, Mike, for those insightful comments. And I totally agree with you. If we can't respond to this and we can't restore scientific integrity, if we don't have the leadership to deal with the next one, it's just even going to be worse. So that's a great point. Anyhow, I'm conscious of the time and what an opportunity is for the students. So I think rather than asking the questions that I have immediately been stimulated to have, I'll just open it up to the group.
And students that put questions in the chat, you may want to just jump in with your questions.
Okay, I see. If you put them in the chat. Okay. Well, why don't we start with I think it's with the first ones there. I can't quite tell the order, but Neelam Patel. Why don't you go ahead?
Hi, I was wondering if the panelists thought that the credibility of American health institutions like the CDC have been undermined by Trump's politicization of the virus, as well as the conflicting messages that were put out earlier in the pandemic. And if so, what kinds of actions will be necessary to reinstate that credibility?
I mean, I would say, hell yes. I mean, there's no question about it that the CDC and maybe second most at the FDA and third most at the NIH, it has. The CDC and the FDA are more in the firing line than the NIH is. The NIH has always been a little more sacrosanct because of the respect of science and also the lack of engagement in the day-to-day activities. Now they get involved with trials, that's different, but the CDC has been most demonized in part because the things they do involve the political acceptance of prevention. You know, improving the health of populations means redefining the unacceptable. And so if you say, well, it's unacceptable not to wear masks, then you provide evidence for that, that's a political issue. When it becomes partisan and when people start to pick their scientists based upon their political views or their extraordinary views, we end up with demonization. The only example I can think of this that was really worldwide known was when Thabo Mbeki, who was the head of South Africa, picked his doctors based upon saying that HIV didn't cause AIDS. And that resulted in the death of hundreds of thousands of South Africans and many children becoming infected because the president said, my experts say it doesn't cause AIDS. Well, he was obviously wrong and he was picking his experts. Morale at the CDC is very low. They haven't been stood up for, I would say largely because Robert Redfield couldn't do it if he tried. He's not bulletproof like Tony Fauci is. And even Tony is getting wounded badly. And he, you know, it's very hard to stand up to the administration. So morale is very low. Most people haven't quit. They're going to hang in there for a few more weeks. And I think that the damage isn't, I mean, I'm being optimistic. I don't think the damage is permanent. I think with the right leadership and consensus building, we can restore science and the word about science. And like Howard Bauchner says, it's not just the CDC and government, it's really scientists in general. When you start to believe in conspiracy theories and a lot of things like that aren't science, it's very hard to respect scientists generally, let alone scientists in government. With consensus building, you can put science in its place without demonizing it. It doesn't mean that we have to open up the whole country because public health says so, but you don't want to lie about what public health does say. So I think that morale is bad. I think it can be restored, but there's got to be a change in leadership. If the president's reelected, we got to have a new director of CDC. And the only thing we can hope for is that COVID gets out of the spotlight and it isn't political anymore. And I'm not optimistic about that.
Let me just follow up on Neelam's point, because the other point she was making was, yes, I think we're all agreeing that the undermining of science and the politicization of it is entirely unhelpful. But do you have any thoughts about whether the agencies themselves, particularly the CDC, has played this all right? I have in mind changing its guidelines on masks, aerosolized spread. But to me, I think that was just evolving science, but maybe it wasn't. But when went ahead and agreed to reissue its school guidelines and things like that. Has the agency itself been strong enough and to stand up and to speak truth to power?
Well, I'll say just quickly first, no. I mean, I think the whole country was caught by surprise by this, and CDC was part of the wishful thinking. I think CDC had a lot of confidence in itself to deal with this the way they deal like influenza, which is to kind of keep track of it. And there was a lot of wishful thinking. I think America in general thought that we're the best, and this will never be like it is in places like Italy, and so I think CDC was part of that. I don't think CDC took this seriously enough initially. However, that's up till maybe February or early February. They've taken it quite seriously since and been ignored. And so I think that in CDC's laboratory capacity wasn't good enough. State and local public health is extremely weak. They have very bad linkages to the healthcare system. We're in a society where we can lay off 1 million healthcare workers and not have enough people to work in public health because of our health insurance situation. So I think the CDC has shown its weaknesses, and the epidemic has shown CDC's weaknesses, but I don't think they're irreparable.
Thank you, Jim.
Yeah, can I just add a piece? I really agree with Jim. I think that it's going to be very important that we actually recognize why we need a strong CDC. If we've ever made the case for it, it's now. And hopefully in the post-pandemic era, we will correct that. We will actually provide the circuit breakers to keep public health out of the political crossfire and as that independent science organization. The other thing I just want to add, though, is I think one thing that's been missed in a lot of our discussions in this country is the pivotal role of the WHO. We have all but neutered the WHO from our own perspective as a country. And the WHO has its own set of problems. And Larry has been among those who have tried so hard over the years to help correct those and improve on the WHO. And I think if anything ever was apparent was why we need a WHO with this event. Okay, the idea that as the late Josh Lederberg, Nobel Prize laureate, once said, a dangerous microbe anywhere in the world today can be everywhere tomorrow. And I think that we've recognized now with the WHO, also its standing is critical to us, and we must do what we can, not just the CDC and the other government organizations, state and local health departments, but also the WHO.
Thanks, Mike. One question here, Howard, is how might science journals better communicate research findings to the public? How do you deal with things like misinterpretation? And one question I had for you similar to this is, how do we reach the people we're not already reaching? A lot of times I think there's this urban-rural divide, this intellectual, non-intellectual divide, elites, non-elites. And, how do we not just be talking to ourselves?
Yeah, so it dovetails with another question about whether or not a journal should endorse individuals for the presidency. And I'll make my comments brief. Firstly, we have a patient page section. So we've had 20 patient pages that are written and directed towards patients about different elements regarding the pandemic. And so I think that always is an important component of what we provide. They're free, and they're both in English and in Spanish. All of our content during the pandemic has been free if it's been related to COVID-19. So that's the first. Second, we know that some people don't want to read, they want to listen. So, we've had about 75 podcasts that have related different issues with respect to the pandemic. Of the 1.5 million followers we have in social media, we estimate that about half are non-healthcare related individuals. So not physicians, not nurses, not nurse practitioners. So we know we're reaching a very substantial part of the public Um, the other issue for me, and it's why we published those 6 pieces together a few weeks before the election. The election will come down to 10% of individuals in 6 or 8 states. We all know that. For the other 40 or 42 states, although it's important to vote, in general, people know in which direction it's going to go. So we thought long and hard about how is it that you want to try to provide information for those individuals so that they would then decide what the future of America should be. And so over the last 3 months, we orchestrated these research letters and viewpoints to come out collectively. And I think if a journal is perceived as being partisan, then the same people that we're trying to influence will stop listening. That portion of the population is being yelled at every day. I don't think they want to be yelled at anymore. I'm hoping that they want to be educated, take the information in, and make a really good decision about the future of the United States. And that's what we've tried to accomplish both with our content as well as the way we deliver that content. We do know it reaches an enormous number of individuals. And so that's particularly gratifying. And I would only point out, President Obama was widely criticized for increasing the drone attacks around the world. Virtually no journals spoke out then. And so I think scientific journals need to be careful about when they decide to weigh in around what could be a political issue and when they decide not to, because they could eventually become to be seen as partisan. They will lose trust and people will stop listening.
Thanks, Howard. I wonder if any of you, especially Jim, have comments on some of the more personal dimensions about this, and also how one of the questioners put up on the chat, what are sort of legal and policy remedies? I am really struck that, the 2 most notable people who stood up and were counted, Alexander Vindman, in the White House, and then Rick Bright in the HHS, the head of BARDA, despite being, quote, protected under whistleblower protections, basically, were hounded out of the government. So, I think that one of the issues, and I heard this from colleagues at CDC who told me things like, when I'm saying, why isn't CDC standing up for itself here? They're saying, well, I have 2 young children and I'm a single parent and things like that, and I'm afraid of losing my job. So I'm wondering, are there legal or other policy things that any of the 3 of you would suggest to make it easier for people to speak up? And also, having worked with many of these people, I have to say I'm shocked that there hasn't been more speaking up than there has, and that some of the things have allowed to go forward, without dissent. And we've read recently, for example, that, the head of quarantine refused to sign an order he didn't agree with, but that only becomes public now. And so I'm sort of astonished that these strong leaders with 20 years of experience, senior managers and career people at CDC and to some degree in other agencies too, have not felt empowered or felt the need when something was going on they thought was probably dangerous to stand up. And I'm wondering what we can do to support them.
Well, it's extremely important, Jesse. I think, I would like to reinforce a little bit what Howard said also. I think that the issue of becoming partisan because other people are is a dangerous thing. I mean, I think that, and I had a good experience writing an article in the Atlanta paper, and a lot of our donors are Republicans, and a lot of our people who are wealthy people at Emory. And I was a little bit worried about that. but they were very happy to see me defend CDC as a resource for our Atlanta community. And without recognizing that this really is not a Republican and Democratic issue. I think that the Republican people who are up for re-election are afraid to change this. But there are many, many Republicans who come out on the side of science and come out on the side of public health. And so we shouldn't make it partisan ourselves because we lose our own credibility. At CDC, I think that people are afraid. And when people are afraid, they either get quiet or they change recommendations. I know from internal people when they were doing their investigations on cruise ships and their investigations in nursing homes, their investigations in prisons and jails. Just from a logical point of view, what happens in nursing homes and what happens in cruise ships and what happens in jails and prisons speak to a criminal type of society that we have. I mean, how can you keep people on a cruise ship infecting each other without any testing? Well, we didn't have enough tests. So we don't have enough tests. We just think that's a normal thing. How can 30 or 40% of the deaths in the country occur in our decrepit nursing homes in the country without everybody being tested every week, which is finally what we're getting around to now? But people are afraid to recommend that. So CDC would make tepid recommendations because they were afraid they'd get turned back or they wouldn't be able to say anything. So all the way down the ladder, policies change because they're afraid they're not going to get accepted because people don't stand up for them. We saw that at the FDA. The commissioner of the FDA and the FDA finally decided that their careers were more important than acquiescence. But acquiescence is a painful thing. It just goes all the way down the ladder. And I think at some point, particularly with political appointees, their career isn't doing what they're doing now. Redfield and Hahn and other people like that their careers are made previously. The career people that have been at CDC for 20 or 30 years do have families, and they have to find other jobs first. And a lot of them work in areas where no one else works. That's what makes them so special. There's only so many respiratory infectious disease epidemiologists needed in universities and places like that. So they shut up, and it's too bad.
Well, any thoughts from you or others on how to support a system that makes it easier for them not to shut up? I mean, at its extreme, this costs many, many lives, and silence is acquiescence.
Well, I'll leave it up to the lawyers, but there are personnel protections about getting fired. But if you take someone like Nancy Messonnier, for example, who is a world-renowned respiratory epidemiologist, and you shove her into a back corner room someplace and take away, what she's been preparing her whole career for, it's almost the same thing as getting fired and just not losing your job,
And that's what they did with Rick Bright.
Yeah, that's the same thing.
But I think, maybe for the law students particularly, sort of looking at least in my mind, looking at some of those protections and how do we make them be meaningful would be helpful.
1,000 current and past EIS officers have signed a pledge on this regard, and that includes many people at the CDC who signed it.
Thanks. I have to run and open my door for a second, but go right ahead. Larry, can you take over for a sec?
Sorry, I was muted. Yeah, with pleasure. What Jesse was trying to ask us whether there are any kind of policies or laws that we could use to kind of insulate agencies. Some agencies you have a core term of office. Whether that would work, I don't know. But how we defend our public health agencies seems to be, critical. I know, didn't FDA science center directors put out a public statement saying that they would not approve a vaccine if it weren't shown to be safe and effective? Could CDC center directors do something similar? What are your feelings on this?
Well, let me just say that again, this has been a major learning experience. And never have we had a period like this where public health was being controlled to such a degree by the political world. As Jim pointed out before, we've surely had challenges. HIV was it, but it was more neglect. It wasn't trying to influence that. And I think that if I could use any analogy, imagine this is a 727 going down with 306,000 black boxes on it, and we need to open them all up afterwards and learn why, and try to apply that going forward so that we don't have this happen again. When I say don't happen again, I mean, the political reality is politicians will do whatever they want. But I think from the protection standpoint for either side, I think they realize having objective, competent information is a very, very important part of policymaking. Now, you may not agree with that science and have a different policy. That's okay. What you can't have is a different science. You can't have your own facts. And I think that if we can get the political world to understand why that is so important and however we can codify it. And Tim, you asked a very good question, how I said about circuit breakers and how could we, in fact, put in place certain circuit breakers. I think it almost becomes an issue of how the laws are written. I was at HHS and helped develop the model for BARDA back after the 9/11 time period. And one of the things that I actually was involved with was helping to establish the concept of emergency use authorization. And the reason was when we had a crisis, we didn't want to have to go through all the standard approvals to get a product available during a major crisis. We didn't anticipate that an emergency use authorization can be used as it is now, or what the issues were. So I think we need to go back and revisit what this pandemic taught us and how can we best improve upon what we've learned, and without recognizing it's going to be perfect. And the final thing I would say is, I hope that we find amongst this group and other public health professionals a more activist mindset. I think one of the things that we suffered from at CDC, and it surely is not a negative comment, but culturally, they weren't used to standing up and standing out. I think that that's a very different kind of culture, but we've now got to give them that more empowerment kind of sense. And that wasn't always true. As Jim will tell you, and Howard knows, is that, the early days of the EIS program, particularly into the 70s and early 80s, were a lot of people who actually had very different points of view. They didn't want to go to Vietnam. And they were, to a certain degree, activists that way and came into CDC, and they actually had a culture that they created there that doesn't exist anymore. Like Jim Curran raising his hand. And so I think that now we have to create a culture that says the role of science is just that critical. We have to have it.
Could I jump in, Jesse? I think Professor Hyman was hoping to speak to this point.
Sure.
Yeah, if I could. I think culture is certainly important, but there are also structural things that you can do to create independence. And Tim Westmoreland actually just has something in the chat about that. Mm-hmm. You can basically create fixed terms, restrictions on removal, varying degrees of independent funding, and whistleblower protections. And the independent agencies that we see around town, although they're not really independent, they ultimately answer to Congress. So the Federal Trade Commission, the Federal Communications Commission, all of them are multi-member bodies where the president can't remove them, and strictly speaking, neither Congress nor the president can tell them what to do. Now, that's not true of most people who are in the executive branch, unless they have some type of protection, either union or otherwise, against removal. And then the last thing are whistleblower protections. But I should hasten to add the empirical evidence is that whistleblower protections are not particularly effective. You pay a real professional cost for being a whistleblower, notwithstanding repeated attempts to encourage people to step forward and speak out. So I'll just stop there. Thank you.
Thank you. Those are great points. One thing that we all discovered on the whistleblower protections is they really have no penalties and no enforcement to include, for example, the actions of the president. So, if there were consequences to violating them, I think that could be, still be a real price to pay, but at least it wouldn't be as easy to just suppress them. Other comments on that? I know we're coming up on time. You know, the independent agency thing is somewhat appealing, but Mike and Jim can probably attest to this. You know, there's a lot of value in having the HHS agencies all come together in one place and not just be, I think part of CDC's challenge actually has been its insularity as an agency. It has good things about it because it's allowed it to often not be meddled with. But you know, if you were trying to manage a pandemic and CDC could do whatever it wanted and FDA could do whatever it wanted, there would be a challenge. But the idea of term appointments where the commissioners of directors couldn't be removed without there being misconduct might be interesting to consider. Mike, any comments?
No, I think that's true. I just remember that if you're in Washington, D.C., I don't care which party you are, you don't want to give up power. And so you don't want to create more independent agencies just because that means you don't have oversight over them necessarily in the same way. So there'll be a challenge between the elected politicians wanting to give away power and our desire to try to provide for independence. And so it's going to be a natural clash, and we're just going to have to try to work it the best we can. You know, you've heard many times in this administration how the president has wished he had done differently with the Federal Reserve Bank, or had, you know, made actions towards renaming, you might say, or naming new members to the Federal Reserve. So I mean, even there, they get the idea that you can do certain things in a systematic way, in an infrastructure way, but it's not easy to do.
The one thing I would say is, I think creating a different structure for the CDC particularly may be helpful, but I don't think it's the critical issue. I don't think we have yet sorted out how social media sculpts public health messages, either in a good way or in a way that's more challenging. And until we can sort that out, it may not make a difference what structure the CDC has. It was always going to be difficult. You know, we're 50 states, Puerto Rico, and the District of Columbia. You know, people often will compare us to the Scandinavian countries, and whenever we see those data, we laugh. Those countries are smaller than 35 or 40 states. You know, if you want to compare Norway to Colorado, I'm willing to do it, but to compare Norway to the United States to me is a meaningless comparison. So I think what we really need to try to understand is, in a modern society with video and podcasts and social media, how does public health messaging change? And I think it's fundamentally different now than it was 10 years ago. And I don't think we really understand how messaging needs to change in an era of absolutely instant news that can be challenged within seconds. It's just very different than 10 years ago. And I know the playbook for public health folks is absolutely extraordinary, but I'm not sure it's been updated to represent what happens in 2020.
I think Howard is absolutely right about that. And it's made even more difficult in our country because of federalism. I mean, the president actually has less power domestically than he does internationally in a lot of ways. So it takes real leadership to get all the states rowing in the same direction. And CDC is always in the middle of that without having any authority. We really don't have a minister of health in our country that can tell his states what to do. You know, and even the FBI, which is independent, can be demonized. So I think that, you know, it's a very difficult thing to do. If CDC were in Washington, it might have more friends. Like I remember when Tim Westmoreland was a young whippersnapper working for Henry Waxman, and he would be coming to visit us in the beginning of the AIDS epidemic. And I was probably one of the only young people at CDC that ever met with a congressional person. Whereas at NIH, they might as well have a laboratory in the middle of Congress, you know. But on the other hand, they're not trying to change what people do in every state, which is what makes CDC so political.
I think we also have to self-reflect. So there was hoarding of ventilators. You know, you had cities that had thousands of ventilators, and they would not send them to New York because they were fearful of the future or what would happen if a disease all of a sudden emerged in Pittsburgh or Atlanta. So you literally had a shortage of ventilators in New York, and we couldn't move them from one state to the other because academic health centers and hospitals didn't want to risk what would happen to them. So we can certainly blame the executive branch, but we have to self-reflect a bit about what we could do better. I'm always concerned when the first thing we do is to say what other people could have done better. I spent a lot of time really disappointed that as a journal, JAMA didn't really recognize what asymptomatic spread meant in mid-February and solicited viewpoint after viewpoint or opinion piece after opinion piece to say, we know there's a shortage of masks, but you can make your own mask. Within a week, 100 million people, we produced 100 million homemade masks. And the number of deaths that would have been prevented between mid-February and probably April 1 are in the tens of thousands. Medicine owns that, not the executive branch.
Yeah, I think these are great points. Well, I'm recognizing the time. Mike, did you want to say something else? No. I would say, though, that the federal government, for example, is sort of there to be a judge and an organizer in these distributive issues. And, I wrote a piece for Mike's thing very early on saying, what the heck are we doing with PPE and ventilators? And, that's what the federal government is there to do. And it abrogated the basic federal responsibility.
They abrogated their role, that's for sure.
Yeah. But anyhow, this has been such a great discussion. And I guess I just in ending wanted to pick up on what all three of you said, and that I have been in government for less of a time, but as I said, worked for 5 administrations and got along with Democratic and Republican secretaries of HHS and commissioners, is that this is an extraordinary time. There is something really different now. And, it's about the people involved. It's about, as Howard said, the channels of communication that make information so challenging and disinformation so easy. And these are really important things. And I think this is so serious so that the students listening to this should not think that this is just kind of a minor problem. And I hope you're all inspired to be courageous leaders of the future. And, as Mike said, activists, whatever that may mean, but activists for your country and for all of the country. And I just think we all have an opportunity. We have to reinvent this, and we really have to fix it, because if it gets worse, we're going to be like Soviet science, quite honestly. And that's not where we want to go as a country. So with that, I guess, would you like, Larry, for us to turn this back over to your?
Yeah, I just really wanted to thank you. I mean, I don't know about the students, but I just sat back in awe at the 4 of you. It was just truly remarkable. I just want to thank you so much because I know how valuable your time is. We'll let you go now, and Jeff and I will then take up the class for everyone else. But it's so lovely to see you all. Take care.
Thank you so much.
Keep up the wonderful work.
Everybody.
Thanks, everybody.